السلام عليكم ورحمة الله وبركاته. أنا الدكتور أحمد لطفي consultant obstetrician and gynecologist, lives in UK, and this is the continuation of the introduction to the course. The course should involve the importance and the clinical relevance of human reproductive system, and this should include the function and the dysfunction of male and female reproductive system, and also the knowledge of sex differentiation, how the baby, the embryo will be differentiated to male and or female. This knowledge should be included in the course. An overview of a male reproductive physiology will be in the course, and all of these are new words which should be in our language. Spermatogenesis in seminiferous tubules, Leydig cells which produce testosterone, Sertoli cells which give nourishment to the germ cells. Germ cells is a term of a cell which can be differentiated to sperm or ova, but in the testes it will be a sperm. And also the Sertoli cells secretes inhibin. We'll know the functions of all these hormones in the course. Gonadotropin releasing hormone from the hypothalamus and the brain will control the luteinizing hormone LH, follicle stimulating hormone from the anterior pituitary. These hormones, these glycoprotein hormones, regulate testicular functions. The sperms will continue to be produced throughout life. And the sperm maturations happen in the epididymis, which is a storeroom for the sperms. Ejaculation of the sperms via vas deferens and urethra to outside. The testosterone is a hormone responsible for libido, muscle mass, secondary sexual traits. Male versus female reproductive physiology. The female physiology is characterized by cyclic hormonal pattern, menstrual cycle, limited oocyte supply from birth. So after menopause, the female will not have oocyte store. Ovulation happens once per cycle, and the female is capable of being pregnant and producing milk for lactation. Male physiology, it continues throughout life, and this needs continuous hormone secretions. Lifelong sperm production, millions of sperms daily, and millions of sperms with one ejaculation, no pregnancy capacity. Spermatogenesis overview. All of this is just outlining the course and the knowledge which we are going to go through it bit by bit during these coming 7 to 8 weeks. So spermatogenesis, it happens in the formation of the sperms. It happens in the seminiferous tubules of the testes, spermatogonia, the primitive stem cells of the sperms, and this will be differentiated to primary spermatocyte, meiosis 1, secondary spermatocytes, meiosis 2. All of this is stages of maturation of the sperm. And spermatids leads to spermatozoa. Spermatozoa is a mature sperm, and this is the end of the spermatogenesis. Sertoli cells nourish developing sperm, and this process takes about 64 days from germ cell to spermatozoa. It takes about 64 days, but there are millions and millions of sperms are kept in the epididymis for maturation and storage. Male reproductive anatomy tests epididymis, vas deferens, seminal vesicles, prostate, urethra. All of this we are going to go through it in the course. A test of MCQ exam, which could be part of your final exam. Which cells produce testosterone? The right answer is Leydig cell. Leydig cell. The cells which produce testosterone is Leydig cell, not Sertoli cells. Sertoli cells secretes inhibin and give nourishment to the sperms. So the Leydig cells, it is an interstitial cells and the stroma of the testis which secretes testosterone. Where does sperm maturation occurs? It occurs in the epididymis. Clinical case: a 25 years old male has low sperm count. The laboratory is showing low testosterone, high LH and high FSH. It is more likely due to primary testicular failure, for example, Klinefelter syndrome. If the FSH and LH are quite high and the testosterone and the sperm count is low, this is primary testicular failure. And there are syndromes like Klinefelter syndrome, which is genetic abnormality, but sometimes it happens without chromosomal abnormality. Male reproductive physiology sheet, for example, like cells like Leydig cells secrete testosterone, Sertoli cells support sperms and secretes inhibin. Pathway is hypothalamus pituitary tests, hormonal pathway. The function of the male reproductive system to secrete testosterone. Testosterone is responsible for the libido, which is the orgasm, sexual orgasm, muscle bulk in the male, the voice, the hair, and also the other function of the reproductive system in the male is to produce sperms, and this is a continuous process, and the sperms mature in the epididymis. Female reproductive physiology, we're going to know the anatomy of the female reproductive system, which contains vagina, uterus, tubes, fallopian tubes, and ovaries. and we'll know about the oogenesis. Oogenesis process is the production of eggs, ova, and the estrogen and progesterone hormones, which are secreted by the ovary and the placenta and their functions, and the endometrial cycle overview. Menstrual cycle phases, follicular phase, and this in the ovary, where the Gravian follicles start to grow under the effect of follicle stimulating hormone, and the follicle will secrete estrogen in this phase, and after the LH surge, luteinizing hormone surge, ovulation happens, and the corpus luteum secretes progesterone in the luteal phase of the menstrual cycle. Fertilization and implantation. Sperms transport through the vagina, the uterus tubes to the ovary, and during this journey, the sperms uh, get uh, preparation and capacitation to be able to penetrate the egg and fertilize the ova, the egg, and the other name of the egg is the oocyte fertilization. And then after fertilization, morula, 8-cell stage embryo, blastocyst, 16-cell stage embryo development, and after that, implantation in the endometrium. Pregnancy physiology will be part of our course. Placenta formation and its endocrinal function. It secretes human chorion gonadotropin, which is a glycoprotein hormone to support the pregnancy, and it's a protein hormone. It supports the growth and repair, and also it secretes progesterone and estrogen to prepare the body uh, for delivery and lactation. We'll discuss in more details the rules of the human chorion gonadotropins, estrogen and progesterone. There are some maternal adaptations during pregnancy and changes in the cardiovascular system and also in the respiratory system. Lactation physiology. It's important knowledge to understand the preparation of the female reproductive system to give breastfeeding for the newborn baby. Puberty and menopause is part of our course to know the secondary sexual characters of the puberty and the age of it, and also some abnormalities of the puberty and the menopause, the age after 50 or 51, when there will be no menstrual cycles and no ovulation, and the changes of the hormonal changes and physical changes during this period. Some clinical correlations like infertility, polycystic ovarian disease, erectile dysfunction will be discussed in the course, and also the contraceptive mechanisms overview, whether it is hormonal or mechanical. Some clinical scenarios, 24 years old female with irregular periods, acne, hirsutism. Ultrasound showed polycystic ovaries, and the hormonal profile, high LH FSH ratio, more than 3 to 1, and high androgens, and also there will be um, low day 21 progesterone, which means anovulation. Infertility evaluation: 30 years old female unable to conceive after 1 year of marriage. The cycles are regular and the semen analyses are normal. So, in this case, the next investigation will be day 21 progesterone to confirm ovulation. This is a case of ectopic pregnancy, 28 years old with abdominal pain, plus spotting of bleeding, minimal bleeding, and the pregnancy test is positive. First thing to come to your mind is it is an ectopic pregnancy, pregnancy outside the uterus in the fallopian tube, which is life-threatening condition. Ultrasound shows no intrauterine pregnancy, and this confirms the ectopic pregnancy. Menopausal hormonal pattern in a 52 years old with hot flushes and irregular cycles. Hot flushes is a common complaint uh, during menopause, and the hormonal profile of the menopause is low estrogen, very high FSH and LH, follicle stimulating hormone, and luteinizing hormone. Um, some MCQ questions. Which hormone triggers ovulation? It is the LH hormone. Thank you. This is the end of the presentation. Thank you.